Hello everyone, welcome to Pharmacy in Our Lives, a pharmacy show sponsored by Guihu Media and Pleasant Care Pharmacy. My name is Dr. ChauPhan. I'm the main host of the show. It's my pleasure to be here to educate the public about different health topics through the perspective of a pharmacist. So sitting with me today is my co-host, and you've seen him before, is Petrus, and he is a first-year University of the Pacific pharmacy student. Petrus, welcome and thank you for coming back.
Thanks for having me again.
Yeah, absolutely. So the goal of our show is to encourage viewers to be more aware of their health and wellness by educating on common health topics, drugs, or pharmacy-related topics. And many of the conditions that we will discuss on the show are preventable and can be managed at home if everyone can understand how important it is to comply with treatment, which includes not only medications, but also lifestyle changes. So today we will be discussing the different medication types for diabetes, because last time you just kind of have a general idea of what is diabetes, but today we want to go into more details about different drugs that you can use for diabetes, and it's a very common disease, and so hopefully this will help increase your knowledge and understand diabetes and its medications better. So to summarize the last diabetes episode, diabetes is a disease that affects how your body turns food into energy and is a lifelong disease for which there is no cure, unfortunately. And those living with diabetes either do not have insulin or have cells in your body that no longer respond to insulin, which result in an elevated or increased level of sugar in the blood, which can then lead to many complications. And one way of treating this is through injections of insulin designed to mimic the body's normal response to sugar and allows the sugar ingested to be brought into the cells from your bloodstream to be stored as energy. So there are two types of diabetes. There's type 1 and then type 2. Now the treatment differs depending on which form of diabetes you have. So for type 1 diabetics, you have to use insulin for treatment, while type 2 diabetes can be managed with exercise, healthy diet, and a combination of both injection or insulin and oral medication.
Let's first discuss the use of insulin. So insulin regimens depend on what kind of eating schedule the patient has. There are 4 types of insulin. There's rapid acting, which should be injected 5 to 15 minutes before or within 20 minutes after a meal. Short acting, which should be injected 30 to 60 minutes before a meal. As well as intermediate and long-acting insulin, which are both injected without regards to a meal. So some side effects of insulin use include low blood glucose, weight gain, low potassium levels, and thickening of fat tissue where it's being injected. So there are 4 different ways that insulin can be taken into the body. First, it can be taken through a vial and syringe. Secondly, it can be taken via a pen. Thirdly, it can be taken using a pump, or lastly through an inhalation. So pens are usually the preferred method because they're portable, discreet, and convenient for injections that are administered away from the home. It also saves time because the pens are pre-filled and have a set dose for accurate administration. However, the pens are more expensive and not all types of insulin are available in pen form. Pens also don't allow for mixing of insulin and also causes some of the insulin to be wasted.
I want to add a little bit about the different types of insulin delivery, because the newly come out medication called Afrezza is an inhaled insulin, and I actually was told by a patient, said, can you talk more about that, and is that a good thing for me, because as you know, insulin, most of them are being injected and people don't like injection, so they thought, well, maybe an inhalation way to get insulin is a better, but actually experts say that that should be your last resort, and it's not it's probably not the best way to go. Insulin injection is the best method still, either through a syringe or a pen injection is still the main way to get insulin instead of inhalation, because inhalation, you inhale through your lungs and that could affect your lung capacity, and it can have long-term side effects in the future. So there you go, for the patient that asked me to talk about insulin, that's inhaled insulin, that's the answer. Well, the next thing I want to talk about is the best places to inject insulin are the stomach, and you should aim for 2 inches away from the belly button and the arms, and then so after the belly button, the best way is the arms, and then after that is the best place to inject insulin is the thighs, and then the buttocks, as shown in the picture that you see here. And it's important to always rotate injection sites in the same general area, because that way you can minimize the development of scar tissue and also allow a more consistent insulin absorption. Now, only place a needle on the pen when you are ready to take the injection, and remove right after each injection. And do not store the insulin pen with the needle on. That could be very dangerous. And when you finish injecting, make sure you properly dispose of your used needles and syringes. And a lot of the times, you should have one of those red, like hazardous waste that you can just right away dispose them in there, and that's the best way. Now, do not inject rapid or short-acting insulin if you're not going to eat, because these types of insulin, they can quickly cause hypoglycemia if you're not eating, we will discuss what is hypoglycemia later. And it is also very crucial to properly store your insulin for best results. Now, you always want to check the storage guidelines specific to the insulin formulation you are using, found on the product package. And do not ever freeze your insulin. That is a no-no. And then another thing is an unopened insulin should be stored in a refrigerator at a temperature of between 36 to 46 Fahrenheit. After you open the insulin bottle or vial or the pen packaging, then the expiration date found on the package is going to be for unopened insulin, refrigerated insulin. Now, once you open it, then insulin should be stored at room temperature below 86 degrees Fahrenheit and away from extreme heat or light. An example would be, so when you open up your vials and to inject with your syringe, the vial during room temperature actually usually lasts for 28 days only, whereas some insulin pens such as Novolog mix or Humalog mix, it needs to be discarded only 10 to 14 days after the first use. And insulin detamere can be discarded after 42 days. So you see the differences in different insulin types. And to make sure that you don't forget, you should write the expiration date on the vial or pen right after you open it as a reminder for yourself.
So earlier we mentioned that one of the major side effects of insulin use is hypoglycemia. But what exactly is hypoglycemia, and what are the resulting symptoms? So hypoglycemia is associated with a low blood sugar level of less than 70 milligrams per deciliter, although this level is different for everyone. Symptoms of low blood sugar include excessive hunger, sweating, tremors, rapid heartbeat, and irritability. Some severe cases can even lead to drowsiness, confusion, or even extremely severe cases of seizures or unconsciousness. If you experience any of these symptoms due to low blood sugar, it can be managed by simply eating or drinking something that is equivalent to 15 grams of sugar. So 15 grams of sugar is equivalent to about 4 ounces of fruit juice, half a can of regular soda, 7 to 8 gummy or regular Lifesavers, or 1 tablespoon of sugar or jelly. It's also recommended that you rest and then recheck your blood glucose after about 15 minutes. If your blood sugar is if the blood sugar level is still low, you should eat or drink 15 grams of carbohydrates again. If a hypoglycemic episode occurs over an hour away from your next meal, it's important that you eat another small snack or complex carbohydrate to prevent the blood sugar from dropping too low again. If you're diabetic, it's important to always carry something to treat hypoglycemia. In severe cases of unconsciousness, often a glucagon pen is used to inject glucagon. This should cause the patient to wake up within 10 minutes of injecting. And once awake, the patient should consume some sugar by mouth immediately. Knowing about this side effect may make people feel worried or hesitant upon starting insulin treatment, but it's worth noting that incidence of serious hypoglycemia is rare, and as mentioned before, it can be avoided by carrying a source of sugar at all times and not injecting short or rapid insulin if you skip a meal. On the other hand, for those who have injection-related anxiety, you should not feel intimidated because the needles are very small and very fine. It's even less painful than the finger pricks that are used for self-monitoring of blood sugar. Therefore, don't let this become a concern or a barrier to initiate insulin therapy. In the long run, insulin is very beneficial in helping you seize control of the disease.
So other treatments for diabetes include oral medications. Now, a common medication most commonly prescribed is metformin, or brand name is glucophage. That helps sensitize insulin receptors in your cells, and it decreases the sugar production in the body. Now, this medication does not cause hypoglycemia like insulin, and alcohol needs to be avoided while you're taking this medication because to prevent a condition called lactic acidosis, which can lead to stomach or muscle pain, unusual weakness, and shallow breathing. Other side effects of metformin, however, include diarrhea, nausea, vomiting, and flatulence, and there's actually a vitamin B12 deficiency in there. Another class of oral medications that's very common are called sulfonylureas, which include medications like glucotol, or the generic name is glipizide, and glyburide. Now, these medications, they promote insulin release from the pancreas, and the glyburide and the extended release formulation of glipizide should be taken with breakfast. Now, the regular release glipizide should be taken 30 minutes before a meal. The side effects of this medication are similar to those of insulin, which is hypoglycemia. So metformin doesn't cause hypoglycemia, but these medications do. They also cause weight gain as well, and they can make you sensitive to sunlight, so make sure you want to wear protective clothing and sunscreen. Now, if you are taking beta blockers, which is very common for those that have high blood pressure, what are beta blockers? So those are taking like atenolol, metoprolol, or carvedilol for treatment of various conditions such as hypertension, angina, or heart failure. In combination with diabetic medications, you should be aware of the possible drug-drug interactions, which are relatively complex. But one point is beta blockers they can promote high level of blood sugar, and by blocking insulin secretion and decreasing the tissue sensitivity to insulin. So at the same time, they can also mask the signs and symptoms of hypoglycemia, such as fast heart rate, tremor, and sweating. What does this mean? It is important for you at home to closely monitor your response. Either there are episodes of too high or too low blood sugar when you're taking both beta blockers and diabetic medications.
Once again, if you're diabetic, it's important that you regularly monitor your blood glucose to recognize daily glucose patterns. We can use these levels to assess the level of control, to prevent hyper or hypoglycemia, and to evaluate your body's response to food, physical activity, and medications so that the appropriate changes can be made. The normal non-fasting blood glucose level is less than 140 milligrams per deciliter, and having a blood glucose level between 140 and 199 is an indication of prediabetes. For those with diabetes, the target ranges are generally between 80 and 130 milligrams per deciliter, and that's before a meal, or less than 180 milligrams per deciliter, and that's 1 to 2 hours after the beginning of the meal. So ranges vary from patient to patient, and they may be different for individuals. So another way to monitor overall blood glucose is the HbA1c test. It basically measures the average levels of blood glucose over the past 3 months, and it's a better indicator than a glucometer, and should be routinely ordered by your primary care provider. It essentially measures the overall average of your blood glucose level over the past 3 months, and not just the your daily levels. So the normal range for the A1C is less than 5.7%, and the goal target for people who already have diabetes is less than 7%.
Okay. So beside monitoring glucose level, diabetics also need to have your routine checkup on other tests that could indicate complications. So first of all, people with diabetes can have an eye disease called diabetic retinopathy. And this is when your blood sugar is very high and it causes damage to blood vessels in the retina, and it can potentially lead to blindness. And screening should be done within 5 years of diagnosis for those with type 1 diabetes, and at the time of diagnosis for those with type 2 diabetes. Now, if there is no retinopathy, eye exam is to be performed every 1 to 2 years to screen for if you start to have retinopathy. And then another condition called diabetic nephropathy, which occurs in 20 to 40% of those that are diabetics, and it is a leading cause of end-stage kidney disease. So therefore, kidney functions have to be assessed annually for those with diabetes. Now, treatment includes optimizing your sugar and blood pressure level, and then you start on appropriate medication and limiting protein intake for those that that want to prevent. And diabetic neuropathy is another common complication characterized by burning, tingling sensation, numbness, and pain, and usually that happens in the feet. So other than improving your blood sugar and symptomatic relief with drugs, yearly foot exam and daily foot care are very essential for those with diabetes. Now remember, you have to inspect your feet every day, wear proper shoes, and avoid injuries, because those with diabetes will have a harder time to heal than those that don't.
Diabetes often also goes hand in hand with other chronic conditions such as high blood pressure, high cholesterol, and heart problems. As a result, our goal is to prevent the development of these diseases or manage them well if they have already been diagnosed. Depending on the severity, lifestyle modifications or drug therapy will be recommended. We have talked about these in the last episode, but once again, we can't stress enough the significance of lifestyle changes. They can make a big difference in slowing down the course of the disease. It's recommended that patients consume less salt, less fat, and consume more vegetables, and just add more vegetables and leafy greens to your meals. It's also important that patients stop smoking and drink more in moderation and avoid excessive drinking. And it's also recommended that patients lose weight and push themselves to stay active. Last but not least, if you are diabetic, make sure that you receive all the necessary immunizations, since you can be more susceptible to certain viruses or bacteria. These vaccines include the annual flu vaccine, the 3-dose series of hepatitis B vaccines for diabetics 19 to 59 years old, and lastly the pneumococcal vaccine PPSV23 for diabetics from 2 to 64 years old.
To sum up our discussion about diabetes, we would like to remind you that even though there is no cure for this chronic disease at the moment, it can be well managed by balancing the food that you eat with exercise and medicine. And this can help really delay and prevent future complications. Many people with diabetes still lead a very long and healthy life, and there are many resources available to you to assist you in living with diabetes. Now, make sure you want to reach out to your doctor, pharmacist, or you can visit diabetes.org for more information. Thank you so much for watching Pharmacy in Our Lives. We hope you find the information useful. And thank you, Petrus, again for being here.
Oh, no problem at all. Thanks for having me.
Thank you. And if you have any questions or suggestions, please email me at chow.fan@pleasantcarepharmacy.com or call us at 510-200-9984. We have pharmacists and pharmacy students from UOP to help answer your questions free of charge. You can also visit me at www.pleasantcarepharmacy.com pleasantcarepharmacy.com. Thank you again for watching.